Interesting. We heard from John Miller talking about a credentialing and a re-credentialing process that within the military service here in the U.S. that they have to go through go through in order to maintain that ability to see patients with those increased responsibilities, but allowances as well. What are your thoughts in terms of what we should have as that baseline type of education or preparation so that we can safely and effectively treat patients as a frontline provider or primary care clinician?
Yeah, I thought about that when I kind of heard the episodes, and I was like, well, at least I think what are we really good at, Jason? I think we're really good at MSK,
Yeah.
and I think if we compare ourselves to what you're given as a when you're getting the education within medicine in Denmark, the amount of MSK curriculum you have compared to the amount of MSK curriculum and exposure you have as a physiotherapist.
Mhm.
I mean, we got so much more than they do, but they need to cover so much more in regards to other pathologies than we do and other things regards to vitals and stuff like that.
Sure.
So they just know a lot, but in regards to MSK, they have very little in their curriculum. So I
Hmm.
think if we start by saying, what are we really good at? We're pretty good at MSK things. So maybe instead of saying we can do it all, we should kind of limit ourselves and say, well, let's at least prove ourselves within the MSK population.
Hmm.
You get my point?
I
So
do.
instead of, I don't think we should prescribe medicine, to be honest. I
Yeah.
don't think we should be given the ability to do injections unless we have like some more training afterwards.
Yes.
I think we need specific training in that if we should start doing that. So if we just talk about what we have in the curriculum, both theoretically and what they're exposed to during their clinical placement, I think we should start seeing the MSK thing.
Hmm. So if we discuss just the MSK patients, and if we do recognize and agree that that's where our strength is, obviously, does the education, the credentialing, the baseline type of competencies need to be established entry level so that when we come out and get our certificate to function as a physio in any respect, that therefore we should be able to see patients as a primary care, or does it need to be postgraduate, some later date? What are your thoughts?
See, I think I don't think you can answer that question that linearly because
Okay.
what we're a small interest slash research group that actually just started to come together a month ago,
Okay.
and where Cecilia, who's part of that group, has just done her PhD in
Okay.
regards to looking at us as primary care providers.
Mm-hmm.
And the thing is that it seems like because we see so few sinister problems, and when we see them we refer them back to the doctor. We don't really have that much experience with it. So when we refer them back, we're not even sure the problem is sinister.
Yeah.
So there's something with our recognition of what we see because the literature can't really guide us that well.
Yes.
So
But
maybe experience is just as relevant. I know people would argue and say the evidence shows that experience doesn't matter.
yeah.
Well, I would argue based on what I've heard from Cecilia and what I've been seeing over the last 16 years in clinical practice and working with young students is that when we look at serious pathology, experience might matter because the pattern of recognition based on how few we see
Mm-hmm.
might be better the more experienced a clinician you are.
Mm-hmm. Mm-hmm. But of
So
course,
yeah, I think we cover the basics that would allow physiotherapists to see people with a direct access. But I think we need to be aware of the responsible and the things that we don't know. And if we encounter something that we're uncertain about, that is not MSK, I think we need to have that. We need to be so humble that we send them back and accept the uncertainty and feel good about the uncertainty. So it's just not about curriculum; it's about personality, and it's about experience. I know that makes it way more difficult than black and white dichotomy.
sure, sure. There are, I think, a precedence of that type of thing where a person has to be out for 5 years before they can function in some role or they have to have so many clinic hours before they can be recognized as an expert or a specialist of some sort, in addition to some additional training. But I can certainly appreciate the time frame and the experiential type of demonstration that maybe a clinician needs to go by, like what you're saying.
Yeah.
Mhm.
Because Jason, you can actually go from the undergrad education where I'm teaching people, where after 3.5 years to go straight into university and do the extra training,
Mhm.
but that doesn't give them any experience. It just gives them 2 more years of theory and a little more practice.
Yeah.
So they're just coming out more knowledgeable, which
Yes.
could definitely be a good thing, because there's definitely a lot of things regarding pathologies we need to be better off, to be more certain, like to triage people better.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.